thank all of you, especially Tata Famhealth, for this opportunity to share some of the views that are current today about heart disease, its prevention. But off the bat, I would like to change the terminology. It's no longer preventive health. It's no longer preventive cardiology. It is predictive cardiology, predictive health. So we now have enough knowledge where we can actually track not only from the genetic makeup, and this is an opportunity to convey to everybody that genes do matter. And if you know your genes, you have a good starting point. So you know when there is heart disease in the family, whether it's in your grandparents, your uncles, parents, brothers, sisters, that already is a blinking red light that you have a propensity for developing heart disease more than the normal or regular population, which does not have any history of heart disease in the family. So that is one. And that coupled with the fact that diabetes is a twin sister of heart disease. Diabetes is a huge contributor to development of heart disease. So if you know your genes about your parents, again, the history of diabetes in the family, you know today that if one parent has diabetes, then the children will have a 25% chance of developing diabetes. So, and if both of them have it, unfortunately, there is a 50% chance that they will develop diabetes. So having seen the warning lights, we need to steer our life accordingly. So we know that there are tests available today. And like you said, genetics is one. Second is the fact that you can detect the earliest transformation of endothelium, because coronary artery disease, as we know it as heart disease, is actually the first signs come from alteration in the endothelium. And today we can detect by many tests, whether it is carotid endothelial measurements or whether it is brachioradial velocity. What we are looking at is the earliest sign happens when the arteries gets stiff. So when they start getting stiff, you know that a person is on the track or at a higher risk of developing heart disease than a population which still has supple arteries for a longer period in their life. So with all these detective tests available to us, if we do an analysis of an individual, putting all our different parameters into one basket, we today have algorithms to predict who will have a higher chance of developing coronary artery disease or atherosclerosis, which is the scientific term for it, and it is all over the body. Of course, the coronaries are more vulnerable. But the point is, if we measure all the measurements that we know right now traditionally from cholesterol to LDL to VLDL to sensitive LDL, so all these things have added up to a point of our armamentarium where our ability to be able to steer heart disease away from an individual does exist. So then, of course, you know the general yarn that we keep giving about exercise, diet control, not eating, oily food. I mean, just to put it in simple terms. So we are saying that those things are what you can do. An individual can understand that what are the components that lead to ill health, obesity, abuse of diet, lack of exercise, use of tobacco. And now another thing that has been added on in the last couple of decades is immense stress. Stress is a partner of everybody. So the question of those days we used to say avoid stress does not work anymore. So if you take it individually and put it in perspective, starting with people who have any history of heart disease or diabetes in the family, they should fall in the category of between 20 to 25 years. We should do our first analysis. That analysis would help us to actually give a predictive model to an individual, and then also timeline when we should be doing the subsequent checkups as we move forward in life. Secondly, like I said, if those people who are more vulnerable must be educated that risk factors are additive. If you are already have a tendency in the family for coronary artery disease, you are abusing your diet in the sense of like trans fats, things which are we know, which is common knowledge now, but we can say it to people that this is what you need to do for yourself because you are already, unfortunately, by birth on a track where you have a higher chance of developing certain diseases. And now cancer is playing a huge role in it also. Now we know that there are familial cancers, we know that there are imprints footprints we can pick up early. So the point is, like the old adage, that we want to react to hoofbeats, not when we see horses. Anybody can see coronary artery disease or heart attacks when it's happened. We are saying we should be in a distant mode where we can sense who are the people who are possibly going to have a much higher chance of getting into heart disease or diabetes or cancer then, and we have the means to do it today. So that's one part that I want to share. The second part is that you divide it up. You are talking about predictive, preventive, then the early detection, and then treatment, and then rehab. So those are the 5 factors of any disease. So if our currency should go now because of the algorithms available to primarily in predictive, then of course preventive.
हेल्थ, फिटनेस और पोषण पर पाए बेस्ट डॉक्टर्स की राय सिर्फ famhealth.in पर और हमारी YouTube पेज माय फैम हेल्थ पर सब्सक्राइब करना ना भूलें।